I think it was a very nice day. So first of all, it was nice to meet people from another country, from Romania, and discussing, because sometimes people think that we are the ones who teach the people who we are meeting, but it's vice versa. We are learning so much. We are learning about the system here, the healthcare system, how they approach. And what we learned today is that you have great people, great physicians who really know how to diagnose interstitial lung disease and also to treat. So I think the overall summary is that it was a very nice day, that we learned a lot, that we have seen a lot. Well, I think one of the big learning points from today perhaps was, especially for the Romanian colleagues, that we need interdisciplinary diagnosis, because if you have a confident diagnosis, then you can go to a confident treatment. And I had the impression that that is something which was needed in your country, and that people now understand why interdisciplinary discussion is so essential, and that you have to have a secure diagnosis, and then you can move on to a confident treatment, being it IPF, being it other fibrosing ILD, being it LIM or whatever. So for the pulmonologists, ask the right question, give clinical information to the radiologist, because otherwise we'll only get some feedback which is not helpful, because if you don't ask the right question, you can never get the right answer. And for the radiologist, I hope they learned today that it is very much dependent on them, that they have to know that treatments differ from the different subtypes of ILD, and why it is so essential to have a good CT and also to have a good conclusion of what we can see in the CT. And that we have to discuss this together with the radiologists, pathologists and clinicians. Well, a big challenge is to have an experienced reader of the CT. Also to have a good CT, so you need a multi-slice thin section CT without contrast media so that you can read that. Also another big challenge is, if you think you need a biopsy, how to get the biopsy, forceps biopsy, cryobiopsy, surgical lung biopsy, very much depending on the experience of your center. And finally, and we didn't have a pathologist today with us, is the pathologist able to read what he sees on histology? That is one of the biggest challenges we are currently having. Well, let's look at on the overall aspect of treating interstitial lung diseases. So what we should avoid is the use of monosteroids in high doses for a very long time, because it may affect lives of patients with IPF. It may affect the lives and the symptoms and the side effects of all the others. So think about what is the disease. If you have a patient with IPF, discuss with the patient to consider early treatment, and it should be the patient together with you to decide, which is also true for all the other patients. And also discuss, for instance, if it's a rheumatological disease, discuss with the rheumatologist what is the appropriate therapy. Well, I think the better you can diagnose a disease, and the more secure and more confident your diagnosis is, the better the treatment is. So you can avoid, for instance, high-priced drugs if you get to the right treatment, and also if you get to the right diagnosis, for instance IPF, where the prices for the drugs are expensive, but you can save a lot of these patients. For instance, looking at respiratory hospitalizations or acute exacerbations. These are all complications which are really associated with very high costs, and if you, by drugs, can avoid these complications, then finally you really have an improvement in your healthcare system, because this costs less than the drugs. If you look back what we had at the year 2000, we didn't have that much of therapy. And then we started to have therapy. Now we have the therapy, and I always compare that to my patients, they will know we landed on the moon. So we were on the Earth, now we landed on the moon, which is that we can influence the course of the disease, for instance, in IPF, but still we see the function. So we know we have to go to the Mars. So we know we have to find new treatments. First of all, we have to stop these diseases, and then perhaps in the next decades, we have to perhaps cure these diseases. I'm pretty sure that we will reach this goal, however, it will take us several years. But I know that in basic and translational research, we are very, very advanced, so we will learn that. For diagnostic perspectives, what we do need is we need some form of biomarkers, be it radiological biomarkers, blood biomarkers, whatever kind of biomarkers. We need something where to say, that is a patient who will progress very rapidly, so do this. Or that is a patient who will be stable over years, so better do this. That is a patient where you should be more aware of this complication, for instance, an acute exacerbation, which may come very soon, or he may have another pulmonary infection or whatever. So we need something which will tell us what is a kind of a crystal ball. We need something which tells us what will be the disease behavior in that patient, so that we can have a kind of a tailored medicine. Be as empathetic as today. Engage yourself in these diseases, because you will learn a lot and you will see how really you will kind of have fun in diagnosing and treating these patients. And my message to patients is ask the right questions. If you have complaints, ask the question, what can I do against it? If you really have an acute deterioration, don't wait until it gets worse and worse, and go to your general physician or your pulmonologist to rule out that that is acute exacerbation.